McCormick. I'm the Executive Director. Oh, I'm muting myself here. Good afternoon. I'm Mary McCormick, the Executive Director of the Rotary Club of Milwaukee, and it's my pleasure today to welcome you to our Thursday snack program. The snack is a little bit different than our Tuesday program in that there's a little bit less to it. We don't have a formal Pledge of Allegiance, an invocation. We don't have any club business. And we typically feature a member of Rotary or a project of Rotary or a partner of Rotary. So it has a very strong Rotary connection, and it will last about 30 minutes. But of course, you can still really count on the high quality program that you've come to expect from Rotary every week. And today we're going to hear from Jenni Sevenich, who is the president and CEO of Progressive Community Health Center, one of Milwaukee's federally funded health centers that has been very deeply involved in caring for people who are impacted by COVID-19. I'd like to mention too that we were delighted to award $2,500 from the RCM Community Trust to Jenni's organization a couple of weeks ago in order to really assist in her community outreach efforts. She's going to be interviewed by our very own pandemic expert, Dr. Bob Gleason, who I think many of you have seen on our programs from time to time. And I want to mention that next week we have another special program. We're going to be joined by Margaret Hoover, the host of Firing Line on PBS. Our own member, Bowden Zachary, the general manager of Milwaukee PBS, has made those arrangements for us. So I'm sure you'll want to tune in next Thursday as well. As I mentioned, this is supposed to last about 30 minutes, and we will close down the program at that time. But we will also allow anybody who wants to stay on a little bit longer and chat with Bob and Jenni to do so. So if you still have a couple questions in mind, please don't hang up. But also the chat function will be open during the program, and Dr. Bob will be looking at that and trying to answer the questions during the program. So I'm going to turn this over to Jenni and Dr. Bob.
Thanks, Mary, and hello, Jenni. We're delighted to do this today to talk about COVID, because many of us, COVID is something that is other people's problem. And I think it's important that we talk to somebody where COVID is a daily part of their life and where they know lots of people who have been ill or sick or hospitalized or died with COVID. This is a very real pandemic, and we need to pay attention to it. I'm going to turn off my video in a minute because I'm at my cottage right now, and TDS only gives me 5, whatever the measurement is, speed, which is very slow, but I'm still here. I'd also like to mention that Jenni has been involved in community health centers in the WIC program, Women and Infant, what's the C stand for? Care?
Children.
Children, thank you. My wife worked for that clinic too. She's done rural clinics in upstate Wisconsin, and for 18 years, she's been the CEO of one of Milwaukee's leading community health centers. She is also the president of the board of Froedtert Hospital, and she comes to us as one of the true leaders in healthcare in Wisconsin. This is no small feat. She's a real star in this world. So, Jenni, let's start by talking about where your clinic is, or who your clinic serves.
Sure. Thank you, Bob, and thank you for having me today. Progressive Community Health Centers, we actually have 4 locations on the north side, and our flagship location is our Lisbon Avenue Health Center. That's between 35th and 36th Street on Lisbon Avenue. And we have medical, dental, behavioral health, radiology at that location. We also have an urgent care next to the Sinai emergency department. And we have a family practice in Sinai in the physician office building. We also have a small family practice clinic in the Hillside Family Resource Center on 6th and Cherry. And we are one of 5 federally qualified health centers in the city. We serve about 16,000 patients per year. 85% of our patients are African American. We also serve, about 9% Caucasian, and we are growing. We are seeing a growing population in the last few years of Burmese who speak Karen, and we're able to serve them as well. And most of our patients, about 95% of our patients are below 200% of the poverty level. 70% of those are actually below 100% of the federal poverty level.
Ooh, that's a what I might call a desperate population right now that really needs health care. It's a population that we read has also been affected hard, hit hard by this pandemic. Do you have patients who've been affected?
Yeah, we have a lot of patients who have been affected, as well as staff. We hire from within the community that we serve. Early on, we actually had the mom of one of our staff people died very early on in the pandemic. And, our patients very often, well, the people on the north side, this is where the outbreak was early on. And we didn't have the resources then that we do now. We didn't really know much about the virus that we do now. And so people didn't have face coverings to wear, so they weren't wearing face coverings. We also didn't have tests right away. We couldn't test people, and the testing criteria was very limited. And so, for many reasons, we saw the virus spread through the north side in the African American community very quickly. We have a lot of essential workers. People weren't able to isolate, and we didn't have resources for them right away to isolate, especially if they're living in a place, a home where there are several people and maybe one bathroom. It's very difficult to isolate. They may not have childcare. They may have to continue to go to work, especially since we weren't testing, so they would go to work. Because they don't have any paid time off, and they don't want to lose their job, not knowing that they had COVID. And so, like I said, it spread very quickly on the north side for that reason.
That's tragic when people feel they have to work and go to work. Sometimes they don't have sick leave, so they go to work. Mm-hmm. Even if they're infected or don't feel well. And that's really a lot of how this spreads. Have you had, and we'll come back to their living situations when we talk about the care you give them after they test positive. What's happened to your staff?
Our staff, we've had a number of staff people who have lost people in their lives. The husband of one of our employees was actually hospitalized for almost 2 months and was on a ventilator for 2 weeks. It's really a miracle that he was able to leave the hospital, and he's still recovering fully. And so they have lost a lot of people, and so they're grieving at the same time they're trying to continue to work. And then we had some people who are working remotely. We've had a couple of staff who have been infected. One of them actually works remotely, but her daughter is an essential worker. And so her daughter ended up bringing it home, and so she was infected as well. And we had another one who was infected, who ended up, the rest of the care team in that particular clinic got tested because they were having symptoms. And while their test came back negative, they still were told to quarantine for 10 days. And so we actually had to shut down that clinic temporarily. And so it's affected our staff morale as well, as you can imagine, when they're losing people in their lives. And these are, we consider ourselves a family. And so we are, as concerned as anybody would be about their family members when our patients and our community is just being devastated by this disease.
So can you talk about some of the people who've been stricken with COVID and sort of what happens to them. And I'm talking here mainly about the patients in your clinic that you know about. And I think
Sure.
we should point out that a lot of Jenni's patients who have COVID, she may not know about. They'll go
Yeah.
straight from their home to the hospital, and the hospital doesn't necessarily check back in with Jenni or tell her clinic staff that somebody is in the hospital with a disease. So, but she does have some stories. And what's the age range of people who've been infected?
Well, of the people that we have tested, we have had as young as 4 months old be test positive for COVID. And our oldest one that we tested was 67, though we did have a 92-year-old patient who passed away in the hospital who had gone directly to the hospital. We have, you know, I have one physician in particular who we talk about his stories quite a bit. And he told me once about a 53-year-old patient who had multiple comorbidities and actually went to the hospital in distress. You know, the ambulance was called because she was incoherent and really wasn't breathing well. And so they brought her to the hospital. Her pulse ox was 60 to 70, and as you know, it should be in the 90s. And she was intubated for 10 days, and she actually made a turnaround too. And so it's interesting how somebody can have such a good outcome ultimately when they have multiple underlying conditions. He also told me about a former gang member who actually turned to Christianity while he was in jail, and he came out and now he's an advocate. And he said to the doctor, he said, I have seen a lot of death, I have caused a lot of death, and I'm not afraid of death, but I knew that death was at the door. I did not think I was going to make it. And he was able to pull through. And then we had our pediatrician, or a pediatric nurse practitioner, had a 5-day-old newborn come for the newborn visit, and mom and dad were positive. They tested the baby in the hospital. Baby was not positive, but mom and dad were, so mom and dad had to be quarantined. So grandma had the baby, was caring for the baby. And they were able to do their newborn visit, you know, over the phone. You know, they had a mom on the phone, so mom could participate in the newborn visit. There was another sibling who was staying with another family member. And eventually the mom and dad were fine, and they were out of quarantine. And as you can imagine, that was quite the joyous reunion when that family could be reunited.
Yes, I'll bet. So you have roughly, how much has the COVID impacted your clinic? You talked about some cases, you talked about people being sick and going to the ICU and recovering, which is frankly the minority of patients who go to the ICU. The vast majority don't make it. But how has COVID affected your sort of daily work in the clinic?
It has turned this clinic upside down. We actually had to cancel all dental except for emergency visits right away. So we did only emergency visits up until 2 weeks ago. We started to open up a little bit to other procedures. And then we canceled all physicals, annual wellness visits, any non-acute visit for immunocompromised patients. And we had to just develop all new workflows. We had to screen people as they came in, put up a respiratory illness care line that people could call to get assessed rather than coming into the clinic. And then a test could be ordered if it was appropriate for that. We had to set up telehealth. We didn't have any telehealth before this. We always wanted it at some point, but this really kind of forced our hand, and we were able to get it up and running pretty quickly. And you know, thanks to the state for allowing us to bill for telephonic visits as well as audiovisual visits, because you know, we didn't have the capability right away to do audiovisual, but we could do telephonic to check in and help manage people's chronic conditions. We could do behavioral health visits over the phone. And then when we had the capabilities of doing audio visual, we have a lot of patients who don't have data plans or Wi-Fi in order to support an audio visual visit. So we had to figure out how we can best manage people's chronic diseases when they either don't have capability of doing a telehealth visit, or can we bring them in and have very minimal contact. So we set up a quick stop lab where they have contact with one person, and everyone is masked and so forth, and they get their labs done and their blood pressures, and then they can go home and have that telephonic visit. So as long as we have their results, we can make sure their medications are being managed, or address their blood pressure or diabetes issues or what have you. So we had to change everything, and we canceled screening mammograms for a long time. We've gotten those back up and running as of the end of May. So that's a concern that people we want to make sure that people are now coming back in as well. So it really did turn everything upside down, and we had to buy up the last laptops on earth in order to get some of our people to be able to work remotely. Billing staff, finance staff, even the call center was able to eventually go up remotely. And so all of this meant a major loss in revenue for us, because our main source of funding really is patient service revenue. So what we get paid from the Medicaid program and from private insurers, that is our bread and butter. And so with all of the lost revenue of dental and medical, we really went into a hole.
Sorry to hear that, but it's not unexpected.
Yeah.
So what's going to happen with these people who have missed health visits, or we read in the paper that people coming for cancer chemotherapy visits in the hospitals are down and things. Mm-hmm. There are fewer heart attacks and broken bones showing up in the emergency room. Well, they didn't go away. They're just not going to the emergency room.
Yeah.
So what's going to happen to those people?
That is a great question. We are actually doing strong marketing and outreach to our patients right now to get them back in, to encourage them to come back in and let them know that it's safe to come back in, that they need to manage their chronic diseases. They need to go to the hospital if they have, stroke symptoms or heart attack symptoms or can't breathe. I think people got pretty freaked out and just stopped going to the EDs. I actually talked to the grandmother of a patient 2 days ago, and she said she is in so much pain, and she will not go to the hospital. She's afraid she's going to get COVID. So I had to really try to talk her into the fact that she'll be safe. And so that's a major concern of ours, is that people are now going to be too afraid to come in just to manage their health, but then also for emergency issues.
So let's use that as a reason to remind our listeners that the clinics and hospitals have now set up kind of parallel systems. If you go to the emergency department and you can comment on this from Freidert's perspective in a minute, with COVID, you go down one hallway. If you come in with a heart attack and you're not COVID, you're going to get treatment in areas removed from COVID patients. And the whole thing is designed today to keep this ICU is for COVID patients only. The whole ICU is COVID patients, and this ICU is other stuff. But I think it's important to tell people that getting healthcare, particularly if you need it, is important. We should continue to get the healthcare we need. Do you have any comments from either your clinic or the Freidert side on that?
Yeah, that's absolutely true. And everyone is screened. When they come in, we take everyone's temperature. You may be asked about symptoms, any symptoms you may have. or have had in the last few days. And everyone is given a mask. If they don't have a mask already, a lot of people do have them already, but if they don't, we give them a mask. We have, hand sanitizer everywhere. And we do a lot of cleaning, as do the hospitals, extra cleaning. And so it really is a safe environment overall.
That's great. Can you talk for a minute, continuing this idea of safety for individuals, what the clinic does when somebody comes in for a test, particularly those that test positive? Because I was intrigued to learn the supplies you have to give them as they go home to their crowded homes with one bathroom.
Right. So I actually have personal experience with this because I went through our process. And I tested negative. So people call our respiratory illness care line. They get taken care of by a nurse practitioner over the phone, and they get an appointment to make a test. They drive up into the parking lot in a specific place. The nurse and MA go out to the car and administer the test while the person is sitting in their car. If they don't have a car, then we have a shed. I've heard them called she sheds, but we bought it from, I don't know where, but it's a shed you would put your lawnmower in or whatever. So we bought one of those so that we would have a structure to test people who do, who walk up, or who we discourage public transportation, but sometimes people do take public transportation. And so anyway, we do have a way of testing them without them having to come into the building. We give them masks, and we can give them hand sanitizer and some disinfectant. That was non-existent in the beginning. And actually that's where Rotary money went, was to create these packets of sanitation packets for people, as well as they get information on isolating and that they should isolate before, until they get the results of their test. We're able to get results within 24 hours. And which is great, because if they're negative, they can go back to work. And if their symptoms allow for that. So then our nurse, one of our population health nurses, calls the patients who are positive and explains what that result means to them, and follows up with them on a regular basis to make sure that they're okay still at home. And then also we have a social worker who works with the patients to see if they are able to isolate. If not, what resources we may have to refer them to, whether it's one of the hotels, or if your kids are not COVID positive, can we send them to a family members, or what can we do to keep that environment as safe as possible? Do you need food? How can we get food delivered to their home so they don't go out to the grocery store and grocery shop themselves, or go to the pharmacy to get medication? So we just make sure that they have as many resources now available as possible. It was difficult to do that in the beginning because we didn't have those resources available for them. And so we were really scrambling, trying to put things together and solve these problems for patients who just, like if I got sick, I have a master, in my bedroom, I have a bathroom. So that would be my isolation, right? I don't have to be around my whole family. Well, that's just not the case for a lot of people. So, and my husband could do the grocery shopping and all of the cooking and so forth. So a lot of people just don't have that. And I think we take that for granted. And so we work with them to make sure that they have everything that they need to stay safe at home.
Well,
You're cutting out, Bob. I can't hear you.
Did I lose? Are you there, Jenny?
Yep.
Did you hear me?
No, I didn't.
It says now I got a message. My internet connection is unstable. Sorry. I was saying you do that because by helping that patient isolate, you're keeping other members in the community safe. You're reducing,
right. other family members too.
Yeah, and that's really what we have to do in order to stop this.
Absolutely.
So what are your big fears about this pandemic going forward? How do you see this playing out?
Well,
I'm not doing this to be negative. I'm trying to be realistic. You've seen good progress in your ability to support people and isolate them and get more of the supplies and the structure and the setup you need to keep people safe. But we read about Arizona and Texas and Florida, where the cases are doubling every 9 days in some places right now. And that begins to feel a lot like New York. So where do you see this going?
I wish I had a crystal ball. I would say I can speak to what my fears are. My fears are that it won't go away. And because of the population that we serve, the people that we serve, they suffer more. They suffer disproportionately than the general population, and for all of the reasons that I discussed and more. And they already are suffering from health disparities. So I'm fearful that our community is just going to continue to suffer and for an indefinite amount of time. And I don't know that we'll have the resources to care for them indefinitely. You know, we scrambled for PPE. I mean, we still, we're not in a great place with PPE, but we're much better than we were. But for a long time, we couldn't even order masks. We couldn't even, you know, we got great donations of face shields, thank God. But we couldn't, we still are down on gowns. You know, we're in the yellow zone for gowns. You know, so I'm just really concerned that people are going to, like, this is old news. People are going to move on, but a lot of people are going to continue to suffer.
Well, let's hope not, but we do have that fear.
Mm-hmm.
And you're in a place where you see it, because that feels so different to be in a clinic where this is real and the people test positive every day and all the time. And you see that how difficult it is to stop a pandemic when you have 6 people living in one house with 1 bathroom.
Right.
And so we thank you and your clinic staff for all the good work they're doing. And we hope that you have the resources that you can get them to continue this, because we need to limit the infection. And that's really what you're trying to do, is limit and control the spread, so that people who are sick and have essential jobs don't go and infect other people at work.
Right.
Let alone their family members. It's a very important package to put together and do right.
Right. And get infected from their job.
Yeah.
Right.
Without any paid time off.
Right. Right. So I think we're done with questions that came in here or in the chat. And I thank you very much, Jenny, for this. And I really sincerely thank you in the clinic. The work you're doing is exceedingly important.
Well, thank you. And I really want to thank Rotary again. That donation is so important. It seems like a small thing for our patients to be given a packet with hand sanitizer and disinfectant and masks and other resources to help them, but it's a big deal. It really is.
Well, thank you, Jenny, for all of the really frontline work you are doing to keep your patients, to keep all of us safe. So thank you for being with us today. I found this really informative, and I so much appreciate the work that you're doing. So thank you.
Thank you.